Right now, we want to turn to something that's been a concern ever since New York announced the legalization of recreational marijuana. Worries about young kids being put in danger by the drug. The Upstate New York Poison Control Center said this week that it's seen a dramatic spike this year in poison control calls involving marijuana edibles and kids. In 2019, it handled 22 of those cases involving people under 19. This year already, there have been 124. And if you look at kids age 5 and under, the number of calls from 2019 until now increased 9-fold. Joining us live to discuss this is Dr. Vincent Caleo, Medical Director of the Upstate New York Poison Center. It's really great to have you on the show. We appreciate your time, and we hear those stats, and it's pretty alarming. Obviously, we have legal marijuana here in New York now. You can't legally purchase it yet, but you can legally possess it and consume it. What do you think specifically is driving this? Just the fact that it's out there more?
Yeah, Michael, thanks so much for having me. And I'm really glad that I get a chance just to speak a little bit about this to the public to help increase awareness. And just like you said, now that, marijuana products have been legalized in New York State, I think we have been seeing a significant increase in the overall availability for young children. Because most of these edible products tend to look like candies or other sweets that children normally like to eat, they're much more likely to try to go after and, eat these products if they see them. So I think that's part of the reason we've been seeing a large increase in the overall number of exposures in the Upstate New York Poison Center.
A lot of the discourse surrounding legalization has been trying to right the criminal wrongs from the past and how the drug laws harmed, some communities more than others. Although, there is this sort of downside to it, I suppose. I mean, the numbers kind of tell a pretty compelling story here. How do you think how do you think we balance those two things, right? Like recreational marijuana is here, it's happening, and at the same time, making sure that kids aren't getting their hands on these things?
I think there are a lot of different ways to try to go ahead and get those two things balanced. Now that, marijuana has been legalized in the state, I think it's really important for people to remember that if they're going to choose to use a recreational marijuana product, to really treat it much like they would any dangerous medication with a young child, especially if there's one in the household. I always remind people to make sure you're keeping these edible products out of sight and out of reach, and if possible, keep them locked in a medication lockbox. Those are all some simple steps people can do to really help decrease the chances that a young child may be accidentally exposed to one of these products.
The state has put in place regulations and rules to try to prohibit companies or individuals or anybody really from marketing products that look like they're geared toward kids. And I think this is exactly why they're doing that. But clearly there are still instances of kids getting their hands on some of these edibles. I wonder if that happens to a family and they call, as 120 plus have done so, what happens when they call the Upstate New York Poison Control Center? Someone answers the phone and helps them, kind of triage and diagnose what's happened and then helps them treat the child? How does that work?
Yep. So anytime anyone calls the Upstate New York Poison Center, regardless if it's for an edible form of THC or for really any exposure, you're going to have the phone call answered by a specialist in poison information. That's either going to be a nurse, a pharmacist, or a doctor, all of whom have had special training in ways to help diagnose and treat people who have been exposed to different medications or substances. After getting on the phone call with one of our special agents, what we'll do is recommend whether you need to, go to the emergency department or seek evaluation from a healthcare provider, or depending on the exposure, whether you may be able to safely stay at home. A lot of that's going to depend on a number of different factors, including what people get exposed to and really a number of other factors for each individual case. But we're always here free, confidential, and 24/7, 365 for you if ever anyone has any questions for us.
Yeah, definitely an important topic, especially considering the numbers we shared at the beginning of the segment. We've been talking with Dr. Vincent Caleo, Medical Director of the Upstate New York Poison Center. Thanks so much for coming on.
Yep, pleasure is mine. Thank you so much.
You bet.